So what does it mean to have dense tissue? So dense tissue is a description of what I see on your mammogram. It's a visual assessment of how much white there is on the mammogram. The white represents the fibroglandular tissue, the connective tissue, like the meat of the breast, in contrast to the fatty component, which is dark. Cancer also shows up white on an X-ray. So white on white can make small cancers harder to see in dense tissue. So the denser you are, the less sensitive is your mammogram. We describe breast density according to a scale of 1 through 4, designated by the American College of Radiology, 1 being fatty and 4 being extremely dense. About 10% of the population will be in ACR category 4, or extremely dense tissue. About 40% of the population will be a category 3. So that means that dense breast is very common. About 50% of the screening population will have dense tissue. So though breast density does make the traditional mammogram less sensitive, it is a very common condition that we are familiar with, and there are excellent screening tools to evaluate breast density, especially with 3D mammography. So what do I do if I have dense breast tissue? There's been a lot of research effort gone in to answer the question, well, how to best screen these women that have dense tissue. 3D tomosynthesis is one measure that we can apply to better evaluate women that have dense tissue. 3D mammography is excellent for all tissue types, but it's very good for dense tissue because it affords better visibility in the tissue. We will often perform an ultrasound in addition to the mammogram in women that have dense tissue, and especially if women have dense tissue and a family history of breast cancer. When we perform ultrasound, breast-specific technologist will scan the breast, and then the doctor will come in and also scan. Though this is time-consuming, this is the way we perform ultrasound, because ultrasound is very operator-dependent, and the more eyes that we can put on you, the better. And studies have shown that ultrasound has the ability to pick up cancers in women with dense tissue that may have been missed on the mammogram. The combination of a mammogram and an ultrasound is a powerful imaging tool, and especially when you add a 3D mammogram into the picture, it's allowing us to see better into the breast tissue, catch cancers earlier, and making me a better doctor.